Hey everyone, Beth Winkler here. I'm the co-founder and CEO of Magnolia Physical Therapy. I'm also a physical therapist of 29 years and have my therapeutic pain specialist certification. So I know a lot about pain, unfortunately, because I've been through it. I've treated patients with it. And I want to share this wealth of knowledge. There's a lot of new research coming out on pain and how it's produced and how we can affect it. Not just with exercise and things like that, but by using our brain and our nervous system. So today I want to talk to you about something called graded exposure. And we've used this for years, decades with physical therapy, where we start a patient with an activity that's small and then gradually increase the level of intensity or duration of the activity. But this can be a super useful tool when you are in pain and you can't really get to doing the things you want to do. So a lot of times patients will, if they can't do something to the level of intensity or duration that they used to do, they won't do it at all. So this graded exposure technique is a great way to get introduced back into movement in a safe way. So some people can't even start to think of going for a walk. They might be in too much pain. So there's a ton of research out there about visualization. They did a study based on people with finger strength. So the person who had, there was a group of people pulling a coil, like a pulley coil for, I think it was 2 weeks, 20 minutes a day. And then they had the other group who just imagined pulling the coil as hard as they could. The group that imagined it had 67% of the gains at the group that actually performed the activity. So that's just one of the studies that shows how powerful visualization is. So if you can't physically do an activity that you want to do, one of the tools I give my patients is a guided visualization. I'll have them visualizing themselves doing the activity. So maybe with their eyes closed, or maybe even looking at pictures of somebody else doing the activity. So you're just getting the brain and the nervous system primed for actually starting to do the activity. So I might do this for a week or two in advance, depending on how much pain my patient is in. And then I'll start gradually adding the activity in. So I might say, okay, what I want you to do is go for a walk just to the end of the block and back, and do that every day for the next week. So the nervous system is really getting used to walking. And then I might have the patient think to themselves too, that this is a safe activity, that I'm not doing any harm. I'm not doing any damage to my body. And that gives the brain and nervous system cues of safety. And when the brain and nervous system have cues of safety, they lower that output, that signal of pain that's going out. So that's one little trick that I like to use with my patients. So feel free to try this at home. It's called graded exposure, starting off with visualization for 1 or 2 weeks, and then gradually increasing a little bit of the activity at a time.